and the spermatic fascia has been cut away like in this one, and if you notice it is attached, the testis, the bottom of the testis is attached to the spermatic fascia here. So to understand the spermatic fascia, where that comes from, you have to know the descent of the testes. So the testes start up in the abdominal cavity up here by the kidney. They're retroperitoneal, just like we said before, and the testes and ovaries start up here. And what they're going to do is they're going to move down through here and through the inguinal canal, which is this canal right here. The body wall is, we've cut it open here, and you can see there's a weakening in the body wall right here. Right on the inside, there's a ring here called the internal inguinal ring. On the outside is the external inguinal ring, and between them is the inguinal canal, which is, there are aponeuroses of the external oblique, the internal oblique, and the transversus there at that point. It's just a weakening. So the testes come down, but before they come down, here's the testes up here. There is a ligament that runs all the way down through the inguinal canal to the scrotal swelling at this point. This is the gubernaculum. So what happens is, yeah, that lovely term, the gubernaculum. It's like goobers. You go to the theater, right? The gubernaculum. So what happens is, what's going to happen is the testes are going to move down through the inguinal canal into the scrotum and down into the scrotum. And the question is, how do they do it? And actually, believe it or not, they still don't know. Even in humans, how testes descend. There's a couple of hypotheses. One, they have shown in dogs and cats definitively that the gubernaculum shortens. And if it shortens, it must have muscle in it. It has smooth muscle in it. A ligament does not shorten. Connective tissue cannot shorten, right? So that's number one. Number two, remember that this animal, this cat, was very, very small. So the distance moved is very small. It didn't have to go from here to here, right? It's very small. Number three is the gubernaculum came out here and attaches to the scrotal swelling. As the scrotal swelling outpockets, it probably pulls to some extent the gubernaculum. So that happens as well as its shortening. So the end product is the testes go through the inguinal canal, under the skin, and down into the scrotum. Right? In both humans and cats and dogs. So if they do not do that, right? If it does not that, you have an undescended testis. It's called testis ectopia. So what can happen is testis can hang up in the inguinal canal. It can hang up under the skin under here, in whatever different positions it can hang up and not go down. It happens in humans. It happens in about the 8th intrauterine month. It goes down, and that's one of the first things the pediatrician does when the baby boy is born, is they feel the scrotum to see if the testes have descended. If they do not, they wait a while, and after about 5 years, they will become sterile. But until then, you have hormone therapy and you have surgery to bring them down, to descend the testes. So they've gone through this inguinal canal and they've gone into the scrotum, and they actually come down in humans at different times. There's a slightly different rate at which they come down. So when they do that, why is a male more prone to an inguinal hernia than a female? Because the testes have gone through the inguinal canal, which nothing goes through that in a female, and it has weakened the inguinal canal in a male. So here is the inguinal canal here, right there. It has weakened the inguinal canal, so an inguinal hernia is much more common in men or boys than it is in women. Another weak spot is right here. This is, in males and females, this is the femoral canal. That's where the femoral artery and vein comes through. It's a weak spot. So in women, femoral hernias are more common than this one, than inguinal hernias, all right? So what will happen is what herniates through there, typically a piece of the gut, small intestine or something, even large intestine. So what it can do is it can just push, it can form a bump right here, it can form a bump right here, or it can push the intestine, small intestine, right into the scrotum. It can be forced right into the scrotum. Yeah, so that is an inguinal hernia or a femoral hernia. So remember, when somebody says, I have a hernia, what type of hernia are you talking about? Are you talking about an inguinal hernia, a femoral hernia? Are you talking about a hiatal hernia where the stomach is forced through the diaphragm up into the pleural cavity? Are you talking about an umbilical hernia where the intestine is forced up by the umbilicus, the belly button, and you get an outie there? See, and there's other types of hernias as well. Here is an example of, and I'll leave this up here so everybody can look. There is a male with a hernia that hasn't gone all the way down to the scrotum. See, I'll show you guys. See? There is a hernia with the hernial sac going right into the scrotum. And then here is the female. Here's an example of a female hernia, probably a femoral hernia. There. See? Yeah, and so inguinal hernias are very common in young boys, actually. It's not older males. It's very common in young boys. So what they do is they push it back in, they drag a piece of the muscle down over the opening and suture that over the opening, and sometimes they put a gauze thing on the inside as well to patch up the hole and stuff. So it's a relatively simple operation. So, go back to this. So when the testes went through this opening, it took with it the fascia of at least three things. It went through the opening, it came through, it took the external oblique, the internal oblique, and the transversus fascia, the connective tissue from those things. So if you were to look at this spermatic fascia here, this fascia, you could actually peel it apart into three different layers. It doesn't look like it, but there's at least three layers there. So that's why you could sit there and peel it apart under a microscope. Also, believe it or not, there is a term, the tunica vaginalis testis. The tunica vaginalis on the male is when it goes through this opening, it may take a bit of the peritoneum, it takes some of this peritoneum here, and also that partially wraps the testis. So you have all those things wrapping up the testes. So where is the gubernaculum now, that ligament? It is attached to the bottom of the spermatic fascia, there. Why is it attached there and not the scrotum? Because when the testis came to here, the gubernaculum was going through here and attached to here, it pulled down through it with it, and that's why it's attached to this fascia, and not the scrotum. Okay? So here is the spermatic cord, and there is the spermatic cord. So what do you think is inside the spermatic cord? What's going to be in there? What's the duct called? Vas deferens, or the ductus deferens. Okay. Looks like wet noodle, wet spaghetti, cooked spaghetti. Okay? There's got to be an artery in there. You know what the name of that artery is?
Gonadal?
Gonadal artery, sometimes called testicular artery. Gonadal or testicular artery, going down there. There is a vein, a plexus, coming back up, a venous plexus, called the pampiniform plexus. So here's the artery, here is the pampiniform plexus of veins wrapping around it. What does that remind you of? Artery going this way, veins wrapped around an artery. What is that? Here's the clue I gave the last lab. Duck's feet.
Webbing?
That is the ducky swimming in a cold pond. Here's a hint. Ducky swimming in a very, very cold pond. It's a countercurrent heat exchanger. That's what ducks have in their feet. Yeah, so I guess ducks do get cold feet. Right? Yeah. Why waste all that heat, pumping all that heat into the water if you're a duck? Right? So here is the testicular artery, gonadal artery, and here's a pampiniform plexus around it. So the warmth, you see, goes right back up, and it keeps it cool. All right. There's also a slip of muscle in here called the cremaster muscle. When it goes through the opening here, the inguinal canal, it picks up a bit of the internal oblique muscle. A bit of the internal. That is called the cremaster muscle. It's little slivers of muscle going down in here. Now, if that muscle contracts, what's it going to do to the testes?
Pull them up.
It's going to pull it down. Why would you want to do that?
Keep them warm.
Keep them warm. Okay. Then there's, of course, there are, inside here, don't forget there's going to be lymphatics, vessels inside here, and nerves as well in there. All that's inside there. All right. This is the scrotum. The wall of the scrotum has the dartus muscle in it. That is smooth muscle. Is that involuntary or voluntary? Involuntary. Smooth muscle inside the dartus. That's the dartus muscle inside the scrotum. If that contracts, what is that going to do? What's it going to do if the muscle inside the scrotum contracts?
Push the testes up?
Pull it up, exactly. Elevate it along with the cremaster muscle to raise it up for temperature regulation. These things are basically involuntary, right? They move it up and down. And when they relax, it goes down and maintains the temperature for spermatogenesis. See? Okay. Now, so if you're going to do a vasectomy on this person now, what do you want to cut? This is the human.
The vas deferens.
You want to cut the vas deferens, but I didn't take my anatomy and I kind of didn't do very well, and I just cut the whole thing, the spermatic cord. Oh, jeez. What's the problem with that?
There's like blood flow.
The blood flow is cut off, so the testis is going to die, and testosterone levels are going to plummet, etc. So you'll be singing in the Vienna Boys Choir after that, right? So when they do a cat, when you do a male cat, what do you take out?
Everything.
Everything, yeah, because you want to totally neuter it, yeah, right. So they cut the vas deferens. So you have to go in here to the scrotum, they go in the wall of the scrotum, make an incision, go in there, pull out this spermatic cord outside, cut it open, get to this, the vas deferens, cut it, ligate it, tie it off, cauterize it, and stick it back in. Now, if you're, this is the left side, and you want to get to the right side, this person didn't do very well in anatomy. So this person is doing a vasectomy and is going on the left side, and is digging around trying to get to the right side. And he can't get through to the right side. What's the anatomical problem? What separates the right and left anatomically? The scrotal septum. There's a scrotal septum that separates the right and the left sides. The road don't go there from here. Right? So you got to go into the left side, you got to cut the scrotum on the left side, and you got to go and do the same thing. So if they do that, they cut the vas deferens, they push it back in, they don't suture it. And you guys who are you cats? You guys in the vet clinics who's vet? Yeah. When you do the cat, you don't suture it back up in the meal, do you? No. No. So just push it back in there, don't suture it. No, it's can the person, can that cat, well, that person, can it inseminate? Yes, yeah, it can do it for a while, yes, yeah, because there's still spermatozoa within the seminal vesicle, vas deferens, and so on. Yeah, so it can do it after that, yeah. Can those things reattach? Can they be? Yeah. Yes, you can. And you can actually have spontaneous reattachment, which is extremely rare. But the vas deferens can reattach itself and establish a pathway. Yeah. And it's very, very rare, but it can do it. But they can surgically do it, but I don't think it's 100% successful. They can do it, though. Go in there, it's like suturing wet spaghetti together, I guess. Yeah. So that's a vasectomy there. So, did you see the anal glands on this cat, the male? You may want to come up here and look afterwards. We exposed them on this side here. There's the anus. There's an anal gland on the male. See that bump? Mm-hmm. That's the anal gland. Now I did it on the female, and the females was very, very tiny. So you guys in the vet business, males normally bigger? Ah, okay, that solves that problem. You just thought we cut it off by mistake. So it's much bigger here in the male than the female. So what happens to the ovary? If the ovary starts in the abdominal cavity, does the ovary descend? Yes, it does. The ovary goes into the pelvis, descends into the pelvis, but it doesn't make it through the inguinal canal, obviously, right? So can I have that one there? If you look at a human, which is a good example there of a human, there's a human. There's the ovary. This is the pelvic cavity. This is called the pelvic cavity here. There is number 16 is a ligament, and is, I think it's 17, number 17. See, 16, 17. Those two big white things there. Notice where they go. Inguinal canal. See? Inguinal canal, just like the male. See, same thing. So if this would go into a scrotum in a male, what's the counterpart in the female? The labia. It goes down here and kind of dead ends in there, right? So what happens is, you see number 16 and 17 is now attached to the uterus. It's not when it first starts. It's up here somewhere in the abdominal cavity, and that comes straight down here to this. When the ovary comes down into the pelvic cavity, this ligament now attaches to the uterus and then goes to the inguinal canal. So it forms the round ligament of the ovary, and no, the round ligament of the uterus and the ovarian ligament, I think it's called. The two of them. So now it's attached to the uterus. It's the same ligament basically as the gubernaculum. Okay? So there is the thing. It doesn't weaken the wall so much in a female, so they're not prone to inguinal hernias like men are. Okay? There's another question. Here's the uterus. Notice the anteroflexion of the uterus. The uterus is anteroflexed this way. The position of the uterus will vary, especially depending on how much urine is in the bladder, right? So the question is, what supports the uterus? Well, the uterine support is actually quite complicated and not 100% understood. But apparently it gets its support from the broad ligament here, from some of the suspensory ligaments, from the rectum and the bladder that nestle it right between the two, and from the ligaments that attach the rectum and here to here, like that. All of that support the uterus. But what will happen is, if the uterus is, there's a diaphragm in here, called the pelvic diaphragm. It's a big muscular diaphragm that wraps around there. Pelvic diaphragm, and there's a little tiny diaphragm shown right here called the UG diaphragm, urogenital diaphragm. That supports it. But if it gets weakened by multiple childbirth, for instance, you can have what is called prolapsed uterus. There is a prolapsed uterus. There is the uterus. See, the cervix is prolapsed right into the vaginal canal. See? Right into the canal. It can get to the point where the cervix protrudes from the vagina. That's a prolapse uterus. See? In this case, the case study here is a 42-year-old